And COVID infections are surging in Florida, so doctors are preparing for more people to end up in the hospital. But healthcare systems are feeling the strain already, and so doctors are sending a warning tonight. Fox 13's Brianna Arredondo is joining us now live from Tampa General Hospital. Brianna, what's the situation for Tampa Bay's hospitals right now?
Hospitals are managing, but there's a delicate balancing act that's going on right now. And tonight, doctors explain how that could tip against them at any moment. COVID-19 infections are picking up again, and hospitals in Tampa Bay are getting ready.
Not rising as sharply as we saw in June and July. I mean, it's not like a SheiKra roller coaster, but it's still a roller coaster, right? We're still going up really high on the curve, and we haven't really seen the top yet.
Speaking from his home via video conference, Dr. Jason Wilson with Tampa General Hospital tells us what he's seeing in the emergency room.
We're still very full right now. We are still surging right now. We're still in a place right now where we're filling up the infectious disease unit at our hospital, and other places are filling up as well.
About 16.8% of beds are available at Tampa Bay's hospitals, and the number of people landing in the hospital is going up. Florida Hospital Association President Mary Mayhew shares from her office that healthcare workers are stretched thin.
As our overall hospitalizations increase, particularly COVID hospitalizations, the challenge is having enough staff to care for all our patients.
On Wednesday, Florida hit 1.4 million total COVID-19 cases since the start of the pandemic. The state's track of the last 2 weeks shows how high cases are surging, and doctors worry the new, more contagious COVID variant could make matters worse.
So now start adding those numbers up, the thousands of extra people, and we then start to have a real capacity problem in this area.
Now that a vaccine is available, doctors want that to be their focus.
The more our healthcare systems and our healthcare workers have to focus on a COVID surge, that's less time that we can invest into getting ways to roll out these vaccines.
And the Florida Hospital Association says that doctors learned a lot from the peak over the summer, so they know how to react. FHA says that hospitals may consider postponing some procedures if the available beds that are free right now get any lower.